Welcome back to Joy in Our Town. I'm your host, Lisa Buldo, and our topic in this segment is health. We're talking about foot health, and we're joined by Dr. Sahani Howie of Family Podiatry Center. Welcome to the program.
Thank you so much for having me.
It's great to have you today. Do you feel that people sometimes take the health of their feet for granted?
Absolutely. It's the last part of your body, but it's the first thing that touches the floor when you wake up in the morning. And so I think a lot of times we don't think about our feet until we have a problem, and sometimes we even ignore it. And I know I did before I became a podiatrist, and people think that your feet are supposed to hurt, and that's so not true. And they put up with a lot of foot pain, and then by the time they come to me, I go, well, if you had come a few weeks earlier or a couple of days earlier, you probably would have gotten back to doing all the things you wanted to do earlier, and you wouldn't be in this much pain.
Right, because most times people do wait until they feel some kind of pain. What are some of the symptoms that somebody might feel before they actually go to your office, before they actually go for an appointment?
Well, probably the most common thing that I see is people with heel pain. And I know I suffered from heel pain for almost 9 months before I actually went out and did something about it, and that's just ridiculous. But a lot of times it's pain, and it's usually intermittent, meaning it'll come and it will go, and it's not something to the point where it'll cripple you. You can kind of work through it or walk through it, but it shouldn't be.
What are some of the common problems that you see when people, with people's feet? What are some of the common problems?
Well, it can range anything from heel pain, which, like I said, is the most common thing, and the official diagnosis for heel pain is plantar fasciitis, which basically means inflammation along one of the bands or ligaments that are in your foot, to diabetics with ulcers, ingrown toenails, flat feet, collapsed arches, then you can get skin cancers even in your feet. And people forget all the time to put sunscreen on their feet. So I mean, there's a myriad of problems, and people fail to realize that, every organ system in your body is represented in your feet.
Wow. So. Pretty amazing. So you specialize in limb salvage.
Yes.
Can you explain what this is?
Well, limb salvage, it's kind of hard to put in a nutshell, but it is what it is. I don't want this little piggy to go to the market. I want to keep all of your toes here because God created you with all of your toes and all of your feet. And unfortunately, by the time people are coming to me, they're kind of let a couple of things go, and now they're in deep hot water. So my goal is to keep you from losing your feet.
How does one even get to that point where they become in need of limb salvage?
Well, to need limb salvage, you're usually either someone who's suffering from diabetes, some form of neuropathy, which is a fancy term that just means nerve damage, or some form of vascular disease, meaning lack of blood flow. Most of the time, it's a combination of all three problems, and it's really a smorgasbord of problems that got you to the point where you have an open sore in your foot or an ulcer, and now you're at the point where you might have an infection that's traveling up your leg, and that's the point where they're calling me saying, oh my gosh, come help. And in residency they used to call me the pus princess because
wow.
I would go in and I would clean everything up, and you may not have the most beautiful feet, but you'll have feet that function.
You're very calm and you're very soothing, so that helps, right? For sure. What are some of the specific challenges for diabetics as far as foot health?
Oh my gosh, I think diabetes in itself is just such a challenge. Diabetes wreaks havoc on your entire body. Yeah. And people don't realize, even to this day, that diabetes can really take away your quality of life, from taking away the feeling in your feet, again, called neuropathy, where all of a sudden people may have numbness or tingling or burning or funny feelings. And these are the early warning signs that people aren't realizing that, hey, that's neuropathy. That's your body's way of saying something is wrong. See, God designed us in a way where our bodies are way smarter. We're just not smart enough to recognize the warning signs. And this is the early warning sign. Typically, people have come into my office and they've said, oh, I've got numbness in my feet, and I've sent them for some blood work, and we've found out that they're diabetic or they're in the pre-diabetic stage. In fact, there's about 26 million diabetics in this country. Wow. And that includes about 7 million people that are undiagnosed.
Wow.
And diabetes does not play fair. It is very prejudiced. It really tends to affect people over the age of 65, but we're finding that with obesity in America, it's affecting younger people, people over the age of 20 even, and more frequently. It also affects Blacks and Hispanics far more than any other race. So diabetes plays dirty. Yeah. So you gotta know the early warning signs, and some of these things are numbness, tingling, and burning in your feet. Again, that's letting you know that you have diabetic neuropathy. The other thing that diabetes does is once you have it, or you're in that like gray zone of being borderline, what can happen is the extra blood sugar, our bodies were so amazingly designed. God says, if you've got extra blood sugar, I'm going to try to figure out ways for your own body to get rid of it. So it'll either get stored in the form of fat and cholesterol, and we all know what fat and cholesterol does. It goes and it clogs up your arteries. So now, okay, we tried to have a fail-safe, but now we have a second problem, which is that you have poor circulation. And if you have poor circulation, it doesn't just affect, you know, the blood flow, it also affects the blood flow to your nerves. And that's actually how you get neuropathy or nerve damage.
Ah, so that's how you'll end up getting the numbness in your feet, the tingling, the burning sensations, and it could be any one of the.
Exactly.
Yeah.
And so that's why neuropathy is your earliest warning sign, because that's letting you know that, look, you have a problem with circulation, you have a problem with nerves, you have a problem with the blood sugar. And, you know, most of these people that are coming in, they're not obese, you know, they're active people, and they're going, yeah, but I do have an extra slice of pie or cake or etc. So those are really the things to watch out for.
Explain peripheral vascular disease.
So peripheral vascular disease, you have arteries and veins, okay? And if you think of your arteries and veins as the major highways of your body, you know, you can think of your arteries as your northbound lanes and your southbound lanes. Peripheral vascular disease talks about the local roads, okay? Not the major highways, but the local roads that go into your hands, to your feet, to your eyes, to your ears, to your nose, all the smaller areas where a big blood vessels is not gonna go to. And when you have cholesterol and plaque building up, that's what's gonna get clogged up faster. Because think about it, if you only have a one-lane road and you get a car accident, you're stuck.
Right.
And that's exactly what cholesterol and plaque is. It's a car accident in your peripheral roads. Now, you have service roads, but sometimes they get messed up too.
Good analogy. So you specialize in heel pain, or you have a specialty in heel pain.
Yes.
School us on Heel Prevention 101.
So heel pain, I'm an expert because I was a fool suffering with it for 9 months. I really should have gone to a doctor, and I didn't. And this was before I became a podiatrist, so I didn't know any better. I was training for the New York City Marathon back then, and I was running, and it hurt. And I just said, oh, just push through the pain. Your feet are supposed to hurt. You're running so much, et cetera, et cetera. And, you know, I was sort of doing stretches, but I really wasn't. And what was happening is whenever we walk, I mean, especially as New Yorkers, we are walking everywhere. Yes. You know? So we spent all this time on our feet. And have you ever seen those bodybuilders? The big bodybuilders, they walk around like this, right?
Absolutely.
Because why? They've built up their biceps so much that they can't stretch their arms out. Well, if you live in New York, you're a bodybuilder, but you're bodybuilding your calf muscles. And so when you rest at night, or when you go for a run and you just rest without stretching, what you're essentially doing is this contraction to your calf muscle. And so, again, our bodies are brilliantly made. So, you know, the laws of biomechanics that God put through says, if I don't have range of motion here, I'm gonna steal it from somewhere else. It's gonna steal it from your plantar fascia. The problem is, it's not meant to be from there. So that ends up rubbing against your bone, and that's where this whole heel pain and heel spurs and et cetera comes through. So you really, the key to preventing heel pain is to stretch.
Stretch.
Yes.
Wow, and that's so simple. But no one thinks of that.
I know. I didn't think of it for 9 months. I went to this wonderful podiatrist and he told me, go ahead and stretch. And I said, you've got to be kidding. I said, where's the magic pill? You got to give me an injection. He goes, I'm going to give you all of those things, but you have to stretch. And of course, I didn't, because I was a horrible patient. And when I finally did start stretching, within 3 weeks, it was gone.
So, okay, are there any tips maybe? Because like you said, New York City, people walk everywhere. That's what we do, right?
Yes.
So are there any tips that you can give us as far as either, stretching, or are there some other things that we can do to prevent not having healthy feet, or to have healthy feet, I should say?
The most important thing is finding a place that can teach you how to properly stretch your Achilles tendon, okay? I think a lot of people are improperly stretching, and that can actually lead to injury, okay? When you stretch before or after your workout is very important, because if you stretch a cold muscle, you can actually create injury. And this is something that we're finding out more and more in the literature and et cetera. So you actually want to warm up first, then you want to stretch, then you want to do whatever your workout is, and then you want to stretch at the end of your workout as well. You also want to make sure that if you are doing something like training for a race or a marathon or something like that, that you have supportive shoes, okay? We have great running stores in New York City, and you can go and you can visit them and they can fit you for proper shoes. And they can give you a heads up of, sometimes from shoe company to shoe company, you're a different size. And especially for women, that's kind of a sticking point, because you know what? I like that my shoe size doesn't change, but sometimes it does, and that's okay. And also, if you may have flat arches or you may have high arches, and these are all things that they can kind of be your first stop to say, hey, you need to go see someone else. And a podiatrist is a great second step to say, you know what, I have flat arches, or I've always had flat arches, should I be concerned or should I not? But if your feet are hurting, that's God's way of letting you know something is not right.
That's what I was going to ask you. So because, how would you know if you need to see a podiatrist? If you have pain, or if you maybe if your sneakers aren't fitting right, what are some ways that you might know if, wow, maybe I need to see somebody?
If the pain's lasted for more than a week, if the pain is not going away, if you got swelling over wherever it hurts, or if it's red wherever it hurts, stop. Do not collect $200. Do not go past go. Go directly to your nearest podiatrist. Those are warning signs that something has gone wrong. Actually, this morning I had a young lady. She loves Zumba, and she's lost so much weight with Zumba, and she felt a little snap and a pop in the back of her ankle.
Oh.
And she said, it wasn't so bad. It was just a sharp tinge, and I was able to keep dancing, so I did. And she's been dancing for the last 6 weeks. Well, guess what?
It worse.
Yes, and now she has a really bad tear of her Achilles tendon.
Oh boy.
Whereas if she had stopped and said, this is not right, it would have been better.
Thank you so much for being with us today. You've been a wealth of information, and thank you for watching Joy in Our Town. We'll see you next time.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.